Well, in this week's Cardiology Countdown, at the number 3 spot, we'll start with an interesting biomarker study that looked at predictors of mortality amongst a large group of whom patients had post-traumatic stress disorder. Now, that disorder in and of itself was, in a multivariate model, predictive of increased mortality. And then increased BNP and mid-region pro-adrenomedulin was also seen to be a predictor of mortality in a multivariate model. And so an interesting finding where this syndrome of post-traumatic stress disorder linked to increases in biomarkers and mortality. At the number 2 spot is an interesting paper from the NERMI registry looking at the absence of chest pain amongst patients presenting with acute MI, finding that happened much more often in women than in men. And there was an age interaction where that happened even more in younger women and was linked to an increased mortality when patients presented with MI without chest pain, often related to increased delays. As patients aged, that increased mortality with the absence of chest pain was attenuated. And so it calls out the notion that the younger, hence lower risk patients, we have to be extra vigilant for MI amongst those without the classic chest pain. And at the number 1 spot are the new chest guidelines. These are a comprehensive review of all antithrombotic therapies across all different indications of DVT prophylaxis, treatment, acute coronary syndromes, acute MI management, and cover the waterfront. It's tens of pages long, just the executive summary. It does add in many of the new therapies, such as ticagrelor, just approved, it had prasugrel as well, and weighs the evidence where newer therapies have outperformed the standard therapies, gives appropriate level of evidence in favor of those newer therapies. And so a useful additional guideline to look for management of antithrombotic therapies. So for this week's Cardiology Countdown, I'm Chris Cannon.